What's up, everybody? It's Brandon here with Low T Nation, and unfortunately, I have a very disappointing announcement to make today. Man, the FDA has done it to us again. And this time, they hosed us in regard to all of the peptides that we typically sell. These peptides are amazing. They're safe. They give people tremendous benefits. They are so cost effective. They're just incredible. The peptides that we typically are, that we're referring to right now are BPC 157. It's a healing peptide. It works on healing mechanisms. It increases like fibroblasts and cytoblast remodeling, depending on the person and the injury, but sometimes to the tune of 50% faster. It's incredible, right? Also, there are growth hormone peptides like CJC 1295 and Ipamorelin. Those are now gone. GHK. Copper is gone. It just several that we use. AOD is gone. That's an appetite suppressant, and it's very frustrating. If you look at the document that the FDA supplied to justify banning these, they made them all what are called Category 2, which means not necessarily safe. These things are so much safer than most, I shouldn't say most, than a gross amount of FDA approved drugs, right? But there's no way to monetize these because they're produced at the compounding level. The molecules aren't patented, and so here we go, right? There's a lot of theories as to why. I'll keep my tinfoil hat off and not rant on that, but part of this, I think, is also these compounding pharmacies are making a boatload of money on semaglutide right now, taking that money out of big pharma, primarily Novo Nordisk through Wegovy and Ozempic. And I think this is just a little FU from the FDA to the compounding pharmacies. If you don't know anything about this, the FDA is not very keen on these compounding pharmacies because it pulls money out of big pharma, and big pharma now funds about roughly half of the FDA's costs. So and therein lies the problem. And so it is what it is. So from now on, guys, if you were on the Ipamorelin with us, we're going to have to switch over to Pharmorelin once these products are gone. Now, we do have a small window of production until these compounding pharmacies completely shut the door on these. They bought a boatload of product. You know, the big pharmacies, the good ones like Hollandale, they had months of this stuff stocked up, so they're allowed to kind of go through their supply, but they're not going to be, once they've used it up, they're not going to be making more. And so with that being said, if you guys want to make a bulk order and stock up, get a year or so worth of this stuff, we have a lot of people asking about that right now. We can do that while supplies last. Once the Ipamorelin is gone, we're going to shift over to Pharmorelin. It's a decent product. It's not as good as the Ipamorelin compounded with the CJC 1295, but it is a good product. And but also, if you wanted BPC or AOD, those are just gone once supplies are used up. So if you want that stuff right now, let us know. We're happy to facilitate. But once it's gone, it's gone. And unfortunately, our hands are tied. I've been on the phone with several owners of these compounding pharmacies. When HCG was pulled, several of the pharmacies, they sued the FDA, and during the active status of that lawsuit, they were still allowed to produce HCG. Well, no one is doing that now. I think most of these compounding pharmacies, they're making so much money on semaglutide and doing some other things. They just don't want any distractions in such a lucrative moment, with some of these other products. So they're just going to have to let these peptides die. It's a shame. The peptides are amazing. They get incredible results. They're incredibly safe. But that's the world we live in, and that's the nature of this beast, unfortunately. So like I said, guys, reach out to us if you want to bulk order some of this stuff. We're happy to take care of you. Once they're gone, they're gone. So y'all have a great day. Thanks.